When it comes to expansion for kids, especially ages 7 to 9, you're not really going to need to worry at all about teeth tipping. The palatal suture is very, very flexible, and whether you're expanding rapidly or slowly, the expansion is going to come really easily. The issue of like teeth tipping really comes into play more with adults when the palatal suture gets a little bit stiffer and more difficult to move. If you're not expanding using the right technique, you're going to tip the teeth out. There's a lot of concern about that with the VIVOS DNA appliance, and certainly if that appliance is used in the wrong way, you can get teeth tipping. What I really like to do when it comes down to like kids appliances is just think about them in two different ways. There are certain kinds of appliances out there that are specifically designed, like you'll take measurements of the child, see how wide their mouth is and how deep the mouth is, and see where they're deficient, and specifically design these appliances so that when they're worn and they're adjusted, that they're custom made and that they will result in a specific amount of expansion, that if you adjust it per the instructions, it'll get that amount of expansion. Examples of those appliances are like Schwartz appliances, like twin block appliances. They typically will have screws in them and you'll turn them in exact directions per the doctor's instructions. Other appliances are non-specific appliances, and the non-specific appliances are MyoBrace, some of the VIVOS appliances that are made, tooth pillow. There's probably a few other ones out there. And what they really are is they're appliances that are made that are typically pre-made, that they come in small, medium, and large, and they have different directions, and they certainly do work. They're going to get some amount of expansion. You're not going to be able to control the exact amount and in what direction always. To be honest with you, I'm not really normally a fan of like non-specific expanders because they normally start a case and get some expansion, but you end up not really getting exactly in any one place when it comes to like growth and development. And then we normally end up having to do other appliances to like finish the case off. I really prefer using specific appliances where we get our measurements and we design them where they get the growth from point A to point B, and we can know where we're starting and we know where we're going to finish, and then we can truly like finish a case and get something done.